Welcome to Retirement Rescue Radio, a show specifically designed to help retirees and pre-retirees maximize their financial efficiency so you can live the retirement lifestyle you've always imagined. Your host is Nate Miller, investment advisor representative and author of the CPR Retirement Rescue Roadmap. Nate discusses thoughts and ideas from some of today's most knowledgeable professionals in the field of finance. He offers strategies along the way to help you make better financial decisions so you can maximize your retirement. This is Retirement Rescue Radio.
All right, Retirement Rescue Radio listeners, we have a very special episode here. We've got a guest with us today, and that is Jasmine Anderson. Jasmine, how you doing?
Good, thanks.
Good. Now, Jasmine is actually one of our team members. And the number of hats that you wear, Jasmine, I think is quite a few, almost maybe as many as me. Why don't you go ahead and give a little bit of background on that before we get too far into this?
Yeah, so before I worked here at Miller Retirement Group, I worked for the Area Agency on Aging here in Ottawa, Kansas, and Franklin County. But basically at that agency, they are known as SHIC counselors, which is Senior Health Insurance Counselors for Kansas. So they're trained on basically just general Medicare information to help provide unbiased information to consumers. So I kind of have taken that training into what I do now, just to provide the best information for people so that they can make the best decision for themselves.
Perfect. Now, I normally ask this question to a lot of my other interviewees that aren't on my team. So I'm going to ask you too. So there's a lot of stuff that, they could probably find a little bit of a bio on our website about you. Is there anything that's not listed there that people would consider fun or unique to know about you?
I don't even know I haven't checked my bio out in a little bit. Who knows what's changed out of this year, but I'm a gymnastics coach, and a lot of people don't know that just because you wouldn't guess that I would do that in my free time. But I've been doing that since probably, I think, the beginning of my graduate assistant years when I was getting my master's. And it just kind of stuck. So I was a cheerleader when I was in college, and so kind of had that trade already going, but I do that in my free time. It's fun. It teaches you a lot of patience, and I just really enjoy doing it. So I'll probably do that as long as I can.
Yeah, that is fun. And I guess along that vein, that probably dovetails into something a lot of people don't know about me either. And that's that I've got a history with gymnastics as well.
Yeah.
When my back isn't hurting from messing it up, lifting a weight that's not even heavy enough to brag about, I can tumble. I can do flips. I've done front flips, back flips, handsprings. Of course, with my martial arts, I can do stuff there too. And probably looks really weird seeing a 6'5" guy do some of that stuff.
Yeah, that is a little bit odd.
Maybe there's not too many 6'5" guys that can do that. Maybe that's why it looks so weird and gangly and just limbs going.
Yeah, the physics don't necessarily work well for that all the time, but.
Nope. Well, cool. That's fun. And it's working with kids too, right? Doing that?
Yeah. Kids from about age 8 up till about 17, 18. So. Fun.
Yeah. Good deal. All right. Well, let's see. Today we're going to be talking about Medicare, and we are now in open enrollment. And so I think you've got a kind of a presentation you kind of want to go through. And so for anybody that's watching this on YouTube, you'll be able to see everything that she's going through. For those of you listening to audio, if you wanted to go to YouTube, you can. You'll obviously be able to get all of the information just by listening to her. But if you wanted something for a little bit of an extra visual aid, you can always go to our YouTube channel, the Retirement Rescue Radio channel there, and check that out. So in order to do that, I think I got to share the screen. I have to give you actually host rights, and then you can share your screen. So we're going to try technology here for a second, people. Hang on one second while we work with this. I'm going to make you the host. Okay. So now if anything messes up, we can blame her.
Yeah, no kidding.
Yep. All right. You are the host now.
Oops. Let me see here. I'm going to make sure that you can still see this too. All righty. Okay, here we go. We can still see everything?
I can still see you.
Okay, can you see
I don't see the presentation yet.
Don't see that yet. Okay, I think let me look in here.
Yeah, I always forget to hit the share button. You have to hit the share button
twice
almost. It's confusing sometimes.
There we go.
Yep. All right.
Now we're working. Okay.
Perfect. Now we can see it.
Yeah. Awesome.
Off
Got
to a
that
great
going.
start.
Alrighty. Okay. Do you have any initial questions that you want to ask? Do you kind of just want me to go into maybe my first thoughts that I have to share, or how do you?
Yeah, first thoughts might work. Like for those of us that don't know, like what is Medicare really?
Yeah, so I'm going to pop this up here real quick, actually, before we start. This is a huge disclosure, but what I want from you to get from this is basically this podcast episode is kind of just more general information to kind of give you some tools in order to help, make a decision for yourself. So I wouldn't take anything that I say and make it a direct decision for yourself because it might be different for you. So our idea is just to expose you to some ideas and tools that you can use for your own decision.
So wait. So you mean that like if somebody's talking to their buddy at the water cooler and they tell them what they chose, they shouldn't actually necessarily choose the same thing?
It could work out for them, but I would say the best idea is probably to just make sure, that's the best decision for you. Yep. Yeah. One size doesn't normally fit all in Medicare. Mm-hmm. So, okay. So you were asking what Medicare is. So it's regulated by the U.S. government, and it serves more than 55 million people, which is a lot of people when you think about it. It is divided into 3 parts. There's Part A and B, which is considered original Medicare. And then there's Part C, which is a Medicare Advantage plan, and Part D, which is prescription drug coverage. So those are kind of the 3 essential parts that we'll kind of bounce around with.
Okay, so we'll go into the differences of each one of those.
Yeah, sure, we can do that. So let's see. So Part A is essentially your hospital insurance. So it'll also cover skilled nursing facilities, hospice care, and home health. And then Part B, which is the second part of original Medicare, is more like just your medical insurance. So doctor's appointments, outpatient care, physical therapies, and stuff like that. And then Part C, which is that Medicare Advantage, it's going to cover everything that Part A and Part B cover. You've got to have that in order to enroll in a Medicare Advantage plan. But sometimes they can offer additional services like dental, vision, wellness programs. And so we'll kind of go into the differences between that and supplemental plan. But for right now, we'll look at Part D also, which is a prescription drug plan. So that obviously helps cover your prescription drugs.
Okay, so real quick, it sounds like Part C is more like a package deal, and Medicare Part A, B, and D are kind of, what do you call it, ad hoc or
kind of like build your own, a la carte, or something that's packaged together. Yep, that's correct.
Okay, so those are the big differences there. What's the cost for that? Because I've heard people that I can't remember the statistic, but there's actually a lot of people that thought Medicare was completely free and did not know that there's actually a cost to it.
Yeah, yep, there is. I mean, there's so many pieces with Medicare. It's really hard to keep everything straight. So I definitely understand where people are getting, the confusion on that. So we kind of already talked about that portion of it. So we'll go into the cost a little bit. Part A, so once again, that's your hospital insurance. The monthly premium on that is actually $0 for most people who paid into Medicare while working. So if you had 40 work quarters or your spouse did, your monthly premium is generally $0. The deductible on your insurance for your hospital insurance is $1,408 a year. So after you meet that, then you've got the cost sharing that Medicare pays 80%, you'll pay 20%. Other pieces under Part A, if you're hospitalized for any reason, which I'm sure a lot of people have experienced this year with the coronavirus, hospital stays up to 60 days, you'll pay nothing. So that's nice. Days 61 through 90, you're responsible for $352 a day. And then days 91 through 150, you'll pay $704 a day. If you happen to be there after 150 days, you're responsible for 100% of the cost. And I know these numbers are kind of tedious to go through, but I like to explain it just because sometimes people think that's what Medicare pays. They're not sure that that's what they pay. So these charts sometimes that come out sometimes can be confusing too. Mm-hmm. If you happen to have a stay at a skilled nursing facility, sometimes people have questions on what that even is. You break your hip or something like that where you have to go and receive round the care, nurse care, that would be something that you would go there for. So once again, days 1 through 20 this time, you pay nothing. Days 21 through 100, it's $176 a day that you're responsible for. And then if you're there after 100 days, you take 100% of the cost. So that's just Part A. Part B, when you go to see your doctor. Now, the premium on this one is not $0. This is based on your adjusted gross income. But for simplicity today, we can just say that most people generally pay $144.60 a month this year. So that can go up based on your income, but we'll just use that. And then the deductible here is $198 a year. So what's important to realize is that after you've paid your deductibles, Medicare pays 80% of the cost and you pay 20%.
Got it. Okay. And so that's the part we pay for. The hospital part we don't. That's what our taxes covered all the time. And the Part B deductible or the Part B premium, that's what we're paying.
Yes. And the only part, that's free on A is that premium too. So you'll still have other costs associated with it, which I just had someone yesterday, but that kind of was tripping them up too. They thought the whole entire Part A was free, it's just the premium. So. Okay.
So big deductible though on Part A, and a lot of additional that we may have to pay if we go into a hospital or have a long hospital stay. So what are the options then to, I guess, help take care of some of those costs?
Yeah. So we discussed a little bit on Medicare Advantage. Sometimes those can pick up additional costs, but we'll talk about the Medicare supplement because that's the most cumbersome. It's not like original Medicare and the fact that it's offered by the government. Medicare supplement plans are offered through private insurance companies. So for simplicity, once again, because Medicare can be very confusing, let's just say we are looking at maybe Plan G. So every single plan, whatever their name was, would have to offer the same exact benefits under a Plan G plan, no matter what. The only thing that can differ between the plans is the rating of the company, which is often done by third parties, and the price that they can charge. So your Medicare supplement plan will help cover the gaps in original Medicare. So we were talking about, how Medicare would be responsible for 80% and you'd pay 20%. The supplement plan would pick up that 20% along with co-payments, others, and deductibles.
Okay, so I want to talk about a piece that I think I just heard you say a little bit ago that no matter what the number, right, or letters, Medicare supplement Part A, B, G, F, or Plan F, Plan G, Plan A, B, and there's a bunch of them. No matter what letter it is that you get, it has to have the same coverage regardless of the insurance company offering it.
Yep.
And so that basically means no matter what insurance company you go with, if you're looking at a Plan G, for instance, it's going to be the same Plan G regardless. You're just going to be now looking for either the lowest price or maybe the highest rating on the insurance company, or, a combination of the two. Maybe service is taken into consideration there as well.
Yep, that's correct.
But it's the same darn coverage.
It is the same darn coverage.
Okay.
Yeah, we can look at that a little bit too, just because there are so many plans that are offered out there. So if you'll notice on the right-hand side of the presentation here where they're talking about Plan C and F, as of January of 2020, new Medicare beneficiaries cannot enroll in those plans. And that is simply because the government decided that they didn't want Medicare supplement plans to cover the Part B deductible, which, just kind of how it is. So people who are already enrolled in a Plan C and F can keep that, just new beneficiaries cannot enroll in them. So the next best, or I guess I wouldn't say best, the next most cumbersome or complete coverage medical supplement plan is going to be Plan G. It's covering everything that these other plans cover. It's just not covering that Part B deductible. So on the left-hand side, we've got kind of the things that it covers here, and we'll go into a little bit of detail. I just want to make sure that you don't have any questions on that before we go into that.
Okay, so it looks like Plan F covered 100% of all of those things. Plan G covered all of them except for the deductible.
Yeah,
$198 a year?
Yes.
Okay. I've heard what's funny is throughout the year, though, that Plan F may have cost more than that extra $198. And so it actually didn't make as much sense to go with that one.
Yeah, but it is. It is quite a bit more expensive. And I think that has to do with the fact that the insurance pool of people who have that plan is getting smaller, and it will continue to get smaller as people age. So it's going to keep going up. So if you're on that plan now and it's looking pretty expensive, you can switch to another one. There's just a different process behind it. So.
Got it.
Yeah.
Okay. So plan G might be the new plan F.
Yeah, I'm kidding. Yeah, it pretty much is. And I have a lot of questions regarding, well, what about plan N? And they're right. Plan N is actually pretty much exactly the same as plan G, except for two pieces here. At the top, these little asterisks over here, basically they'll pay your coinsurance and copayment. But first, there's a $20 copayment for doctor's visits and $50 for emergency room visits. And you don't have that on a plan G. And then at the bottom, this excess charges, plan G covers at 100% and N does not cover at all. So people might be saying, what the heck is an excess charge? Sometimes if you see a specialist or you're seeing a doctor that accepts original Medicare, that doctor can still choose to charge up to 15% above that Medicare approved amount. And then you are responsible for 100% of the cost. There's no split on it. So plan G would cover that and plan N wouldn't. So just a little added perk in there.
Sounds like fewer surprises.
Yeah. Yep. A little bit more stability there. So that was a lot of information. So I like to use this chart sometimes to help show what that would actually look like as far as covering your cost. So we've already got this $0 premium on your on your Part A insurance. The Plan G supplement plan would cover that Part A deductible. So we just slashed that out there.
So there's
down under hospital.
$1,400 a year gone. Okay.
Yeah. Yep. Down under hospital stays. It's going to cover your co-pays for days 0 through 150. You're still going to be responsible for days 150 and up, but it will cover the days before that. If you've got to stay at skilled nursing, it's going to cover days 1 through 100. So that's nice. And then on the right side under Part B cost, you're still responsible for that Part B deductible. But once you've met that deductible for that, Medicare will still pay the 80% and your supplement will pick up your 20% that you were responsible for.
So if you're on YouTube right now and you're looking at everything that you used to be responsible for, most of those now have red slashes through them, and the supplement pretty much picks up the majority of all of that.
Yeah. Yeah.
So I guess from a planning standpoint, if we're looking at this and trying to incorporate it into retirement planning, unexpected expenses, especially health expenses, and it's a big risk in retirement. Mm-hmm. And so what this does, it doesn't completely get rid of that risk, but it does vastly reduce that risk. It's much easier to budget using something like this, in my opinion. Budget your budget. Yeah.
Yep. You can absolutely budget a little bit better with something like this. That's correct.
Okay. All right. What's next?
Let's see. Okay. Well, we haven't talked about Part D, so let's talk about that a little bit. And I will preface this with everybody's Part D situation is different, because I really haven't found the same two people that take the same prescription drugs. It's not very common. So there's a lot of different prescription drug plans out there. And so I'll just say that there's a lot of information on these next couple slides, but they don't always apply to the same people in the same way. So Part D is an optional drug benefit. It's intended to help Medicare beneficiaries, reduce out-of-pocket drug costs. It's regulated by the federal government, just like the original Medicare was. So you can get it one of two ways. You can get it through a standalone insurance plan. So when we were talking about build your own, you can have Part A, Part B, you can add a drug plan, and you can add a supplement plan, or you can have your Parts A and B, and you can add a Medicare Advantage plan. So some Medicare Advantage plans don't offer a drug plan, and depending on the type of that plan, you can either add it on your own or you can't add it at all. So there's a lot of different components that go with Advantage plans.
Just to make it confusing.
Yeah, I know, right? All these if then, but this, yeah, There's a lot of that. So this was the slide I was when I started talking about prescription drug plans, kind of prefaced with, all this can be different for everyone.
Mm-hmm.
Some people never reach their deductible. Some people reach their deductible in January and May. You know, it just depends on the person and the type of medications that they're taking. However, these numbers are pretty standard for everyone. So when you reach the coverage gap or the donut hole, when you reach catastrophic coverage, those are the same limitations with the drug plan.
Okay. So there's a few different ones there. So
Yeah.
So when does someone enroll in Part D?
Okay. Yeah, good question. So it will depend on when you sign up for the other pieces. So we'll talk a little bit about eligibility too. You can be eligible for Medicare even if you worked, you know, out of the home and your spouse is eligible. So that is a way to be eligible for it. To get a prescription drug plan, you at least have to have Part A. You don't have to have Part B to enroll in a drug plan, but you at least have to have Part A. And then if you're wanting to add a drug plan through a Medicare Advantage plan, you do have to have Parts A and B. So those are the two ways you can kind of get one of those.
Okay. Oh yeah, sorry, go ahead.
No, you're fine. Go ahead.
I was going to say, are there any type of penalties if someone does not enroll?
Yeah, good question. Yes, there are some penalties. So if you're working still and you become eligible for Medicare, you don't have to sign up for Medicare. You can delay your coverage if your current work insurance is deemed creditable, which your HR department, wherever you work, can help you determine that. I'd like to say most are. It just depends on how many employees work with you at your place of employment and so forth. So it just depends. But there is a penalty. So if you don't have creditable insurance and you just choose to not get it because maybe you're not taking any medications, you don't want to pay the premium, whatever the case might be, there is a penalty. This is tricky. It's 1% of the national monthly average for every month that you're not enrolled. So depending on what the monthly average is for that month, you know, it just depends. It could be $4 a month that's added on to your premium, could be 10, but that penalty is added on to your monthly premium for life once you do decide to sign up for a drug plan. So it could get kind of expensive if you wait several years to enroll. So it just depends on the person.
And so that's whether or not somebody's currently taking drugs or not at that point, right?
Yeah. Yeah.
So you could be having somebody that's completely healthy, doesn't really need any drug plan, but if they don't sign up for a drug plan, they might be hit with a big old penalty later.
Yeah. Yeah. And it used to be that I think the least expensive plan used to be around $15 or so last year. And going into 2021, there are a couple plans that are only about $7 to $8 a month in premium. So they've lowered that. And I think to maybe offer people in those situations where they're not taking any drug plans and they just need some kind of backup coverage, but at least they've got it and they won't experience the penalty later. So
good.
I like that they did that. Yeah. Okay. So I wanted to touch a little bit on how do you enroll in Parts A and B, because that can be very confusing too. So if you're already receiving Social Security benefits or railroad benefits, you will automatically be enrolled in Medicare Parts A and B. If you want to delay that, you'll have to tell the Social Security office. Otherwise, they'll just automatically enroll you. If you're not receiving those benefits, your initial enrollment period is 3 months before you turn 65, the month of your birthday when you turn 65, and 3 months after. So you've got that time period to kind of get enrolled, get in touch with the Social Security office, or you can actually sign up online. And then they will send you your Medicare card.
Okay.
A couple different ways there. So we kind of already touched on that about when your initial enrollment period is. I wanted to talk about, yes, there it is. So a lot of people are still working when they become Medicare eligible, and they want to keep their work insurance, which is great. If you've got it and it works for you and it's simple, that's perfect. If you decide later that you want to get on Medicare, there's not going to be a penalty for you. You'll have a special enrollment period, which is issued to you due to losing work insurance that was creditable. So you can enroll later at that time into whatever pieces you want to. And then we already kind of touched on the open enrollment period. or the initial enrollment period, excuse me, all these open, special, initial, all the verbiage
A lot
they
of
use.
enrollment periods.
Yeah, a lot of enrollment periods. What we're in right now, Nate, you mentioned at the beginning, is that annual open enrollment period, which is from October 15th, and it's getting ready to end on December 7th. So that is for current Medicare beneficiaries who either have a Medicare Advantage plan or a drug plan, and they're wanting to switch that. So that is when they can do that.
Okay, so that annual open enrollment, that's only for changing the drug plan, or if you're on a Medicare Advantage, changing that.
Yes.
What about if you're just on regular Medicare A, B, and you've got a supplement? When can you change those?
When can you change the supplement? So it really just depends on, well, I would say it kind of depends on your health status a little bit, in the fact that if you're already receiving a supplemental plan and you're past your free look period, you're subject to medical underwriting, which just means that the company might request that you get a physical and submit that to the company, so that they can choose if they want to accept you or not.
Okay.
So it's a little bit more difficult just in the fact that there's a few more hurdles to get through, but you can change it, but you can change it at any time, your supplement plan. So there's no enrollment period for that one.
Okay, so the enrollment period for regular supplements is pretty much any time. And why would somebody want to change a supplement program? Let's say they're healthy, they're not dealing with any of the underwriting issues and they're healthy. So why would someone want to even look at changing a supplement plan?
Yeah, good question. So each plan is responsible for maybe increases in price that they have, and each plan is different on how much they increase that each year. So sometimes people want to change just because they want a lower premium. Maybe they're not satisfied with the level of care that they've received from their supplement plan, and then that, they filed appeals and it wasn't successful. So those kind of reasons. I really have only seen someone want to change a plan due to the price, though. Yeah. And so that, that just kind of goes up, and it's based on your age. So those would be the only two reasons that people generally change.
Okay. So once again, it kind of goes back to the fact that all insurance companies offer the same coverage. It's just some might be more expensive than others. So it's worth looking at it, especially if you get that letter every year and then all of a sudden you notice that there is an increase. That might be a really good time to probably shop around.
Yep. It's good to look into it, and you can look into it every year or whenever you want to for that. So,
okay. That's good.
And then,
all right.
Yep. And I want to just clarify that your Medicare supplement plan, if you choose to not enroll in your initial enrollment period or during your special enrollment period, you're still going to be subject to that medical underwriting. So if you don't get it when you can, you'll be subject to that later. So it's important to keep that in mind. Yeah. Definitely.
Okay. What next?
I think we've only got a couple more things. We kind of talked about these important dates, that annual election period, which is about to end on December 7th for people in Advantage plans or prescription drug plans. And then January 1st through March 31st are for those who are on a Medicare Advantage plan and want to go back to original Medicare. So they want to go back to the build your own type of structure. Yep. So that's for them. And those are really the only other important dates to remember for those.
Okay. So real quick, how would you, in maybe layman's terms, talk about the difference between Medicare with the supplement and then Medicare Advantage, since those seem to be the two main ones to choose from?
Yeah, good question. So I like to look at it as a Medicare Advantage plan is kind of a pay later situation, where generally the premiums are pretty inexpensive, like maybe $0 to, I don't know the limit, but a lot of them do run around $0 in densely populated areas. And then a supplement plan is more of a pay now and don't pay later, because you'll pay the premiums that will cover all of your costs later. So it kind of just depends on what you're comfortable with, if you like, what kind of situation you prefer. If you feel pretty healthy, sometimes people go with Medicare Advantage just because they don't think they're going to use it that much. It really just depends on your situation, what you're comfortable with.
Okay, so pros and cons, definitely. It sounds like it might be a little less expensive up front or monthly, but it might not cover as much if a catastrophic thing happens, as far as like Medicare supplements might. And so, yeah, health is definitely going to be a consideration there. If you feel like you're pretty healthy, then maybe the Medicare Advantage might be the way you go. But then I guess the question would be is, when do you switch back? Because
Yeah.
a lot of health issues can, kind of just creep up on you like that.
Yeah.
So, okay.
Yeah. So if you enroll in a Medicare Advantage plan and then for some reason something happens and you've got a health crisis, a lot of times you can't change until that annual disenrollment period from January 1st to March 31st. So you've got to wait and kind of just take the cost until then. So,
and there'd be, at that time, they'd have to go through underwriting again for the supplement if they wanted to get any kind of supplement too, wouldn't they?
Yeah. There's one time, either first time that you switch back, you get like a special enrollment period for a supplement, but other than that, you don't get any more. So, yeah.
Got it. Okay. So then it sounds like, well, I guess then in your mind, what would you say is some of the biggest mistakes or some of the things that people want to make sure they do when they're approaching this decision?
Yeah. I think I would just it's really important to have an understanding of what costs you do want covered. That way, when you're looking at the specific plans, you can kind of pinpoint that piece of information that you want, just because there's so much between each plan and the different plan types. You want to make sure you're getting covered what you want covered. And then also I would make sure that you're aware of any penalties that you might incur, and additional cost after you've received a service. So I would say cost, and then make sure you're getting covered what you want covered with your plans.
Okay. And how would they be able to find out that? I guess basically how would you work with somebody to help them figure out the answers to those questions?
Yeah. So generally I like to do kind of just like a quick phone call consultation to kind of figure out your situation, what you might be looking for. And then from there, I'll do a little bit of research on my own through all the insurance plans that are offered, even if it's not something we're contracted with, just to help you get that information. So I just build that quote kind of around what you're looking for. And then based on that information, you can make a decision on what you want to do.
All righty. Okay. So then, and is there any charge for that kind of a service?
Nope, that service is complimentary. So we're just happy to provide it and give you the information. And if we can help you along the way and it happens to be something that we're contracted with and can help you with that application process, then that's perfect for you. But otherwise, we're still happy to help. And it's just a service that we offer. It's just a bonus.
Okay. Well, then how would somebody reach you?
Yeah, so I will, in the show notes, I'll give you the Calendly link that we can put in there. And then I can also be reached by email, which is Jasmine, JASMINE, @millerretirementgroup.com. Or you can call my phone number, which is 785-813-1222. And I'll put that information in the show notes too. So either of those methods are fine to contact me, and I'll get back to you when I can.
All righty. Well, I think that's all the questions I have. Do you think there's anything we may have missed?
I don't think so. It's a lot of information. So I would just say, take it all in and then.
Right. Maybe if you're listening to the audio, maybe rewind that. If you're watching the video, maybe rewind a few slides back and find some areas that might be more applicable to you, and then just reach out to Jasmine so that she can help. She's extremely knowledgeable in this area. That's why we put her in charge of it. So yeah, we're just looking to help you guys live the retirements that you deserve. And, if we can help you save money on your Medicare, your health expenses, insurance expenses, we want to help that way too. All right, Jasmine, any last words of wisdom?
Nope. I guess I would just say, due to timing, stay safe and stay healthy.
Definitely. We got the holidays coming up. So stay healthy, everybody.